Hey, everybody, and welcome back to the Outcomes Rocket. Saul Marquez here, and I'm so excited to be with Meghan Seus today. She is the Senior Vice President of Product for SONIFI Health. Meghan's responsible for developing product innovation and user adoption strategies, and she works closely with health leaders to identify tech-based solutions for real-world challenges in healthcare. I have the privilege of meeting her at the HIMSS meeting this year, 2024, and I really loved the things that they were doing in the booth with their televisions and their entertainment systems that were really kind of consumer friendly. And I said, Meghan, we got to get you on the podcast. So glad we're finally doing this, Meghan. Welcome.
Likewise. Thank you so much for having me.
Oh my gosh, such a pleasure that we finally lined this up. And look, before we talk about the really cool things that SONIFI Health is doing, talk to us a little bit about you. What got you into the healthcare space? How did you get into leadership? Tell us the story.
Yeah, gosh. My career in healthcare really started at a pretty young age. My first job was in healthcare. I worked at a local family-owned Rexall pharmacy in my hometown at 15 years old. And it's interesting because I've been reflecting on it a bit about, just my career trajectory. And I trace so much of what's inspired me to work in healthcare to that very first job. Had a mentor there for a few years, the owner of the pharmacy, Mr. Gaskins, who I remember fondly, had a really indelible mark on me. And just seeing him interact with the community members, not only be a medical expert, but really take the time to connect personally with these people in sometimes a vulnerable state, and how that had an impact on, just their medical compliance, their course of care, and just the community as a whole. So, so that's kind of where it started and inspired me to continue on to where I am today, which is working in product, as you said, in healthcare technology, and really just, trying to continue to innovate through that level of compassion, empathy, and connection to the consumers of the products that I work with.
I love it. Yeah, and that's so important. Coming from that lens, it sounds like that first job, you're the pharmacy owner. He really had an impact on you, and you really haven't looked back since.
Yeah.
That's so great. And now you're infusing that compassion for what you do today at SONIFI. Talk to us about what SONIFI Health does and how they add value to the ecosystem.
Yeah, sure. So SONIFI Health is really all about enabling healthcare providers, health systems, with solutions that allow them to create best-in-class environments. So we have a lot of customers that say, we really want to elevate the patient experience in our care settings. And we know that we need a mix of people and technology and change management. A lot of these things need to come together to make that a reality. So that's where we come in. We're pieces of that puzzle. And we really try to develop solutions that are grounded in anticipating the needs of patients paramount, but also the care team members that are caring for them. So more specifically, we're developing and implementing smart room technology. So think of the buzz term hospital of the future, or smart room of the future. That's really where our technologies fit into the mix. So our core solutions include an interactive TV application, the one that you saw at HIMSS. We have a digital whiteboard solution that replaces that dry erase marker board in the room, entry signage that's at the point of entry of a patient room. All of these things integrated with the electronic health record system and other third-party health IT solutions to create. And by the way, our products all integrate with each other to create this ecosystem, this wraparound experience that is all about getting patients access to the information they need when they need it, as well as care team members to improve safety experience and really just support the overall quality of care initiatives that our customers are prioritizing.
That's great. And it's about, when I think about the consumer experience, I think of Dallas Airport. I think of Amazon. I think of prediction of what you may need, clarity of the pathway forward. Talk to us about what you guys are doing as far as the consumer But I also think about the consumer as, like you said, the provider, right? So what are you guys doing that's different in helping both the patient and the provider?
Yeah, so what we're doing, a few things. I think what sets our company apart, our solutions apart, it starts with a mindset. So we really try to infuse a hospitality mindset into healthcare, and that's not only because our corporate roots are in the hospitality space, working with the Marriotts, the Hyatts, these large international hospitality brands, but it really is more of a mindset. It's about that anticipating the needs, using the data that we have about how millions of users interact with our solutions. Where are they navigating? When are they navigating? Where are they getting tripped up? Really transforming that into a patient experience that makes sense for all patients at disparate health literacy levels, at disparate, tech savviness and different ages, and really designing tailored experiences to meet them where they are is one thing. We've been at this for several years now, so just the knowledge that's been built by the organization over these years is really now, I think we're kind of at this great point where we're really hitting this spot of being able to bring to market these solutions that are getting patients where they need to go. Um, and then, a unique thing about SONIFI, there's a lot of different software-based solutions in the space today. We are really a systems integrator. And by that, I mean, we're taking our software, we're integrating it into different hardware-based solutions. So smart TVs, mobile devices, different, POE signage displays. And that's a unique thing, right? There's a lot more that comes into the mix there that you have to get right for these things to be stable and to perform as expected, which is 24/7 in a hospital setting. Um, so I think it's really the culmination of those things. It's, the hospitality mindset, using data, as well as more of the subjective feedback from our consumers that we're constantly working with our customers to get, and then just that system integrator expertise and how we implement our solutions in very complex, large enterprise settings is some of the things that really set Sonify apart.
Yeah, no, I love that. So some great things there, and a good differentiator is you're not just the hardware, right? You actually help bring it all together. It's the software and the integration where you come into play.
Yeah, absolutely. I mean, there are some technology providers out there that are like, we're just software. It's up to the health system to focus on that hardware piece of it. And we get that, but we also see a lot of value in helping our customers with a turnkey solution, because sometimes it's that intersection of hardware and software that can cause some issues. So we really
Yeah,
see value in being able to give them that end-to-end solution.
I love that. And any medical device integrations as well, or is this strictly monitors and
Yeah, great question. So we have done some work with Fitbit integration for ambulation programs at some of our research hospital, at one of our research hospital partners. There's definitely, more coming into play. We're doing a lot in virtual care now in the inpatient space and using, the real estate of some of the displays that we already have in the room for those two-way videos. So integrating those with some of the patient monitoring tools. So it's definitely going in that direction. And I think it all goes back to what I mentioned before, that wraparound experience, creating that ecosystem of all these different technologies, which may or may not be, Sonify's developed and innovative solutions, but it might be partnerships with third parties to create that experience that's frictionless for patients, but importantly, as we've talked about before, for staff members too.
totally? Yeah. And look, there's not enough real estate in the hospital room for another monitor or another thing. So
That's right.
the more
Yeah,
integrated, the better, right? Oh, go ahead. You were going to
absolutely.
mention.
No, I was just concurring. I mean, absolutely. These rooms are tight, and jamming more equipment into them is actually defeating what our customers are trying to do. They're trying to create more, calming, comforting environments with less technology. We want it to fold into the background, right? So that's our goal.
Make it
Yeah.
invisible, make it just
Mhm.
support people. So give me an example really around this idea of technology and trends. Give me an example of how you guys have been able to leverage any trends or technologies to to really help your customers have those aha moments?
Yeah. So, gosh, I mean, there's a few. Let me think about a good one here. I guess I'll pick up on a thread that we just chatted about around virtual care. So, there's been a big trend, as we all know, since pandemic time when virtual care programs and, getting quickly tablets deployed to rooms where people could FaceTime or use other Skype, whatever. There was a rush towards that. Now is like the dust is settled. We've all kind of reached our new norm a few years ago. It's like, okay, there's a lot of benefit in these virtual care workflows. How can we use them for things like, nurse rounding? How can we use them for interpreter services? And rather than still requiring the nurse to kind of wheel these carts into the room and, still facilitate it, how can we use the SONIFI solutions that are already in the room to do this hands-free without somebody needing to be there? And to do it in a way that the user who, probably isn't tech savvy or isn't feeling well enough to be tech savvy in a hospital bed can engage in these different clinical workflows that frankly are required for a lot of our customers these days due to staffing shortages and just the desire to make sure that their clinicians are practicing top of license and reducing operational costs, all the things that I'm sure your audience is very familiar with. So, using our technology to enable these different use cases has been really exciting. Also, just like seeing how some of our older population, who you might think is less savvy and sometimes is actually really welcoming the technology around things like voice assistants and using voice assistants to control the television and to navigate to different features within our system and show me who's on my care team right now, or show me what movies are available. Anything from clinically integrated features to more of the entertainment or positive distraction features. Them using an Alexa device in the room to do that has been pretty cool to see. So yeah, it kind of runs the gamut.
That's awesome. No, some great examples. Really appreciate you sharing those, Meghan. And look, we're here at the end already. Just very interesting to hear about how you guys are bringing it all together, integrating devices, pushing software that really helps make everything easier for providers and patients. So leave us with the closing thought. What should we be thinking about, and what's the best place for the listeners and viewers of today's episode to reach out to you and the SONIFI Health team to learn?
Yeah, closing thought. I guess I'll go full circle back to a concept that I mentioned at the beginning, something that's really a driving force for me right now. This concept of innovation through compassion. Your audience is working in healthcare technology. It's not easy a lot of days, right? There's a lot of headwinds. There's a lot of friction, whether it's internal at your organization challenges that you're overcoming or external factors, regulatory, for instance, right? There's a lot that we're dealing with day to day to try to move the needle forward. I just find it to be a really anchoring concept to do good work and to keep that North Star in front of you. And, I think that making sure that we're tapping into the users of our technology, the users of our care, if you're on the health provider side, both their suffering and their joy. And what can we learn from that? And how can we take that, empathy, that compassion, and really translate it into innovation in healthcare delivery or supported by technology is something that we think a lot about at SONIFI. And then how to find me, LinkedIn. It's the go-to, right? So Meghan Seus on LinkedIn. I would love to connect with anyone. Thank you.
Love it. Meghan, thank you for closing us out on really such a real point. If we do the right thing, if we do it with empathy, things work out and the business grows and people get healthier. This is why I think more women should be in charge of healthcare. That's my perspective. And I think I probably hear and see a lot of heads nodding on this episode. So I'm glad you're in the seat that you're in, Meghan, and doing what you do. Folks, thanks for tuning in for another episode today with Meghan Seus, Vice President of Product for SONIFI Health. All the show notes are going to have the links to get in touch with her, links to learn more about the company, and the short notes to get a quick summary to share with your friends. Meghan, such a pleasure, and thank you so much for being with us.
Yeah, likewise. Thank you.